Welcome to the Tudor Dixon Podcast. Today we are going to be talking about a startling new study that was just released showing the rising risk of dementia. It projects the number of dementia cases in the U.S. will double by 2060. I think this is probably a fear of most Americans, is the idea that you forget who you are, that you're not capable of functioning. I mean, we've been watching, people questioning even the leader of the country right now. And I think mostly because the idea is just very terrifying to have this happen. Now, more than 1 million Americans are predicted to develop this condition every year. It's estimated that there will be 12 million Americans living with dementia by 2060. So today I am joined by one of the leaders of the study, Dr. Joseph Coresh, who is the founding director of the Optimal Aging Institute at New York University's Grossman School of Medicine, and Arjun Masurkar. He is a cognitive neurologist and dementia specialist and leads the laboratory for early Alzheimer's disease symptoms at NYU. Thank you both for joining me.
Thank you for having us.
Yeah, absolutely. So, like I said, I think that the majority of Americans hear this, and it's one of those things that you're scared of. All of us, I think everybody has experienced one grandparent or a parent that has gone through something like this. And I think it's hard. It's really hard to be the person watching, and it's very hard to be the person going through it. I remember with my own grandparents, my grandfather started to struggle with this. And for my grandmother, it was so challenging to see that decline. So when we see a study like this is sort of scary. Dr. Coresh, tell us about it a little bit.
Yeah, so we thought it was important to take a lifelong perspective because, as you say, we all kind of know that we're in a very long game for this. So we had the advantage of having a study that followed 15,000 people since the 1980s, so for 4 decades. We had the advantage that the study really went rigorously in determining who got dementia, and we can talk about that. And we asked the question, for someone like myself, or someone who starts out at age 55, over my lifetime, will I reach dementia before I die, or will I die before I reach dementia, right? Only 2 options if you go forever. And we found out that the old estimates were off. And our estimates are that 42% of us will reach dementia before death. Now, before we all panic, I think it's very important that by the age of 75, this number is only 4%. Still a scary 4%, and we can talk about who's at higher risk. By the age of 85, it goes up to 20%. And as you say, we know quite a few people who get dementia by that age. But then the part that's important is when you go beyond 85, when we went to age 95, that's more than half the risk. And that's when things really pile up. And we can talk about the idea of what do you do for prevention early? What do you do for prevention medium? What do you do for management later? And most people can still stay at home, as Dr. Masurkar will talk about various options and collaboration.
When I see 55 being like that point where you start to see it, that is a few years away, and that is very scary to me. So how do you even know that this is happening? I think that's another part that's scary to me, is that the person who's experiencing it doesn't always know it's happening.
Yeah. So I think there are very good news in the last decade, right? So when people thought about dementia, we still don't know all the causes. And again, we can talk about the different processes. But Alzheimer's dementia, degeneration of brain cells, is a big process, and vascular dementia is another huge process. The good thing is vascular risk factors are treatable, and that component of dementia is reducible, right? So high blood pressure, diabetes, physical activity, no smoking, alcohol, sleep. Those are all among the 14 factors that the Lancet Commission has said can reduce the risk of dementia by 50%. And we can talk about the fact that even if you have high genetic susceptibility, you can still benefit.
So it's interesting that you mentioned alcohol. So I'm a cancer survivor. I was at my 6-month appointment a few weeks ago. And at the appointment, the doctor really laid into you can't have any alcohol. You can't drink at all. It's so important. And I was sitting there thinking, does she think I'm a total lush? Why is she saying in 10 years, we've never had this conversation. And I was like, I don't drink. Like, I don't drink at all. And she was like, not even but I'm saying not even a glass at night. I said, I don't drink. Where is this coming from? Well, then the story was published that now they're saying that drinking alcohol is linked to cancer. And I'm hearing, okay, alcohol is linked to dementia now too. I mean, how significant of a problem is it? Because I do think that in the last, I would say my generation coming out of college in the 90s and early 2000s, there was this really big push for women to be in this wine culture. And it seems like that has impacted health in a crazy way that we really aren't paying attention to.
Yeah. So I think I'll take a broader perspective and then dig into the alcohol. I think it's important to realize we're living a long time, right? So if you talk about diet or meals, alcohol, we have about 100,000 meals to eat, right? And I think it's important to say, so one meal you ate badly. Well, you can even smoke 40 cigarettes in a day and you're not going to get cancer tomorrow, right? If you smoke 40 cigarettes for 30 years, a couple of people will get away with it, but a lot of people are going to have trouble. So I think it's important to remember it's a marathon. We're all going to fall down and we all should have things that we can enjoy. I think related to that, I think with the alcohol, people are too tempted to go strong one way or the other, right? So, we're just tempted to give strong answers when sometimes we have weaker answers, right? And so it depends. If you socialize and it helps you, it's one thing. Clearly, there's this thing among, younger people and anxiety where people have binge drinking and a lot of drinks at a time. That's a problem. Risk of injuries is a problem. With dementia, when you get to older age and your reserve is smaller, it could be that one or two drinks will push you over an edge where you can't compensate. And I see Dr. Masurkar may be ready to chime in with that. I think then we want to know if you want optimal health, which is what we're looking for, we're trying to develop all the best biomarkers to give you the very best advice, right? So I think doctors shouldn't be pushing you to drink. In fact, now we're pushing you to not drink. But I have a feeling if your only vice is a couple of drinks a week, I think you may have a lot of other things to worry about. And in terms of dementia, one of the proven risk factors for dementia is social isolation. Now, I think we can socialize without alcohol. It's not a problem. But you know what I mean? But social isolation is bad.
But it's like that. I can't focus on those few really terrible sunburns I had in college for the rest of my life.
I think dwelling and ruminating, not a good thing, even though we're all victims of some worrying.
Well, I think this is one of those things, though, that you can. I mean, you can have genetic testing if you have relatives who had Alzheimer's, people are getting that genetic testing. Then what happens once you find out you have the gene? Then do you just focus on that? How bad is that for your health that you are constantly worried, well, when's it coming? When's it coming? When's it coming?
Yeah, so it depends. And I've given a lecture to the medical students at various places and to students of public health about genetics and epidemiology and screening. And apolipoprotein E is always an example I raise because we studied it for heart disease where it's a weak risk factors, whereas apolipoprotein E4 was discovered in the 80s to really be a pretty strong risk factor for dementia. For a long time, I said, well, we don't screen for it because there's nothing we can do. It turns out now we've discovered that the vascular risk factors interconnect with the amyloid deposition in the brain. And our study and others have shown that people with more vascular risk factors have even more amyloid deposition, and the association was even stronger among genetically susceptible people. So in some sense, your preventive measures could be more powerful if you're at risk. Now, do you need to know or not? A good question. Maybe, I'd be interested in Dr. Masurkar's opinion about, particularly as you get to the later stages and how people deal with this. As you said, they may not know. It's one thing to not know about your genetic risk. But do you know about your cognitive function? Do you want to get tested, and what do you do?
Yeah, absolutely. I think we're learning more about how to use genetic testing as the years go by. I mean, right now, I think it still stands that the genetic information, like an ApoE test, can give some sense about general risk, but it's not an absolute. It's not that kind of gene. That being said, there are ways that a person who's concerned about their memory can more concretely assess their risk by getting an evaluation by a geriatrician or neurologist, or even talking to their primary doctor first. A lot of the memory concerns that are out there, if they're not very consistent, if they're not affecting daily life, it might just be part of what we call normal aging. And I think that if you want to know if it's more than normal aging, you might need some more formal diagnostics in the form of what we call neuropsychological testing, quantifying someone's memory and cognitive functions, doing some brain imaging like an MRI, and doing some blood work to look for maybe non-neurological causes of memory loss.
Interesting. So if you are in this situation where you start to see this decline, I mean, we're seeing that 1 in 3 older Americans dies from Alzheimer's or dementia. Obviously, people are fearing that. How are you dying? Are you dying with it? Or are you dying from it?
Well,
go ahead.
I think, back to the numbers, I think, often when you develop a disease and you're 90, it's hard to know all the causes of it, right? And at that point, the number of years, which will be one of our future topics, is an important topic, right? So I think it's important to think about this opportunity for prevention. And I think the other thing, that I'm a big believer on, avoiding the social isolation, engaging other people, taking charge of your own health, and accepting that I think we should try for the best health, but we're going to have setbacks, and there are ways to work with them and have lots of meaningful things, as you mentioned, right? You've had cancer. I wouldn't know. Seems like you're doing great, which is wonderful. Congratulations. The same things with a lot of things. So if somebody has some limitations at older age, working together with their family members, working together with their physicians, a lot can be done.
So what is it that we should be doing? I think especially in this country, we're very hot on the quick fix. Just give me something that's going to make all of these things happen. But I heard you talk about exercise and diet, and those are things that I think oftentimes feel like I don't really know what that means. So I'm going to focus on something else. I mean, exercise is pretty obvious. Diet is a challenge in this country. I mean, we're just seeing that now the FDA is saying that we can't have red food dye. I think it's red number 4 or 3 that they've just eliminated. And people are talking about making America healthy and all these things that we have in our food that Europeans don't have in their food. And is this contributing to the health record that we see in the United States as compared to other countries? So when you talk about diet, it seems kind of like an enigma. Nobody really knows what that means. How do we break that down for people?
Yeah, I think, we can each say something. I would keep my eye on the big things, right? And that exactly what we eat, it would be great if we could figure it out. But for 100,000 meals, maybe we don't even want a prescription for every meal. But the biggest problem people have is too many calories, right? Too many calories. And when they add up, because there's a scale and, you step on it and you see what happens. The good thing is if you lose even 5 pounds, it reduces your risk of diabetes dramatically, right?
Really?
And yes, it turns out losing is better than gaining, more powerful for diabetes. And connected to dementia, we've shown that diabetes before the age of 65 is a powerful risk factor. And if you prevent it altogether or delay it, onset at a later age is a much, much weaker risk factor for dementia. So for diet, I'd watch calories and I'd watch total fruits and vegetables. The more fruits and vegetables, the less you can eat other stuff.
So we see a lot of people today taking drugs like Ozempic or Wegovy, these drugs that were for diabetes. Now people are finding out that maybe they prevent diabetes by losing the weight. They take these drugs and they lose the weight. Is that a sustainable way to take care of your health?
I'll start and have Dr. Masurkar continue. I'm in public health. Ideally, we should take care of things with behaviors. And
Okay.
I think the good thing is we should study that. We should know about it. But we're in medicine because people aren't perfect. So when you fall, we don't just blame you. We look for solutions. And in the US, We have incredible medications, an incredible healthcare system for people who can access it. And for high cholesterol, we have wonderful drugs and statins. For high blood pressure, we have a range of wonderful drugs that are cheap and very effective. And controlling blood pressure is one of the best ways to prolong life, prevent dementia, and prevent stroke. And obesity is an underlying cause for so much of it that if it takes a pill, it turns out science has now given us pills that seem to be good for us. For decades, we only had weight loss pills that were bad for us. Now they seem to be protecting the weight, the diabetes, the kidneys, the heart, and we're going to study them for the brain. So the answer is still out as to whether it's a huge benefit, but it's clearly a huge benefit for many things. What will happen over decades, I don't know. What do you think?
I think that there are certain people who are, really struggling with their weight, struggling with their diabetes, that are going to really benefit from medications, like Ozempic, etc. I just don't think that that it can for the average person or someone who's slightly overweight, whether diet and exercise. I think that diet and exercise and the changes that can occur from those lifestyle changes are probably going to be more efficacious long term, right, than taking a drug short term. I think you just can't replace the effects of those kinds of lifestyle changes.
Yeah, and importantly, it's not either or. I think actually we're getting sort of the wrong message, right? In many ways, the GLP-1 receptor agonists, and they're going to get better. I've already seen presentations where, right, you lose weight and you lose muscle. Now they've got compounds to potentially protect and increase muscle at the same time. So it's a changing game. But they help you have better behaviors. And I think there's no reason people shouldn't really try hard to then, when they're at the lower rate, establish good patterns of behavior and test whether they can maintain them. I'm not at all sure that it's not possible.
So you've been working on this study, like you said, this has been going on since the 80s, and you've come out with the fact that dementia risk for folks over 55 and older has doubled. Do you think that is because you've been watching it, and has it really gone up over that time frame? Have you seen a change? And seeing that change, what were the contributing factors to that change?
Yeah, so actually this is where being detailed on the numbers is important. The risk will double in the next 40 years by 2060 because the population is aging. Actually,
because we're getting older than we used to be, or because we...
Yes, because the whole baby boomers are, when they're 90, it's going to be a lot of risk. So for the US, the numbers will double. For any one age, we're actually doing a little better now than we did before, partly because of better education and some better risk factors. The problem is, as a country, we're going to have to do much better because as a country and as a world, we're aging rapidly.
So when you say we're aging rapidly, what are the details of aging rapidly? Because, in my mind, I'm like, the years come. That's the one risk factor I can't do anything about because I'm going to get older no matter what I want that to be. Is our body aging faster than what the number is?
No. I think we keep doing better. So as individuals, I agree. You and I need to keep watching it. And as we get older, we realize we've got more risks, more complications, and the risk of dementia becomes bigger. And we talked about preventing about half the risk. As a country, right, the number of babies that are born drives the number of young people. And if there were more people born in the baby boom, then the percentage of the population that's over the age of 65 will double. The percentage of the population that's over the age of 85 will triple. And as that happens over the coming decades, I think we need to think about the fact that many people, if they're in good health, can continue to be very productive, have lots of wisdom, have lots to contribute for potentially decades beyond age 65. Right?
It's really interesting, though, that you say that it's how you look at the numbers, because obviously the headline in anything like this is going to be written so you click, right? So the headline was kind of terrifying. It's like dementia has doubled. Why? And so in my mind, I'm like, oh, all of us are losing our minds faster and quicker, and it's going to continue and it's going to get worse. But it really hasn't changed. It's not like more people are getting it. It's just that more people are getting to that age. So that to me is a major difference. But I just was having a conversation with someone in their 20s last week, and he was saying, we're not going to have kids because look at healthcare is a disaster. The world is falling apart. And it just made me think when you said that, it's how you are looking at the numbers. The younger population doesn't seem to want to have kids because they're looking at numbers differently than what they actually mean. And whether it's health numbers or financial numbers, I think this younger generation is being scared away from adding to the population, which is really sad to me.
Yeah, lots of issues here. I think the press did pretty well with this, but there really is an element of this that's scary, which is if I go my whole life, the risk is 42% that I'll get to dementia before death. I try to emphasize that it'll be late in life, right? So I have many years and I can extend them. And I think then this whole population pyramid is quite interesting as to how we do that. And I think how we maintain a vibrant society. But I think that's both having young people and realizing that many older people are young in so many ways.
I think this is also a changing landscape. I think in the course of the next decades, we're going to come up with better and better ways to detect the very beginnings of dementia, even before it's really dementia. We're going to be developing more drugs that are disease modifying to slow down or stop the progression of memory loss. I mean, there's already 2 amyloid lowering therapies approved in the last few years. And so I think that's just the first step. I think it's going to really change in the next 30, 40 years.
Yeah, I think talking about maybe the biology of dementia at early ages versus late ages is important, and maybe Dr. Masurkar wants to expand on that and sort of, the early Alzheimer's and late and therapies and the importance of an integrated approach like we do at NYU Langone Health.
Right. So I think, one of the first steps in the Alzheimer's cascade is the rise of amyloid. And that's really been the focus of a lot of research and clinical trials. And that's led to these 2 drugs that are approved in the last few years that we're giving at NYU. And they are helpful. They do slow down the process. And then at later stages, there's other processes like tau. That's another toxic protein. And there are ongoing clinical trials to target that. And then there's, at both early and late stages, inflammation, and the immune system can play a critical role. In early stages, it could be actually a good thing. And so there are methods perhaps to boost the immune system to help clear out amyloid and tau that could be helpful. And then at later stage, anti-inflammatory methodologies could actually be very helpful as well. And so this is really a multi-dimensional pharmaceutical strategy that's really been built up after all the science has been done over the last few decades.
I think we're so used to looking for a problem once we feel something is off. And what I am sort of hearing from you is before there's warning signs, eventually there will be checks. And medicine has sort of been caring. In the past, medicine has been caring for a problem that's already there. And it sounds like this is a lot of preventative medicine to say, okay, you're at the very beginnings of this. But I don't think that we as a society have been trained well for preventative medicine because we don't like to go to the doctor unless we know something's wrong. Is this something that you see like mammograms where it's like, okay, at this age, you should be getting tested for this so that you can prevent it?
I think we're getting there. I think we have the methodologies to detect people who are don't have dementia but have impairment. And that's where we stand now in today's science. And I think that we're pushing that bar to earlier and earlier stages. Does an amyloid reading mean something in a normal person for their future cognitive impairment? We don't know the answer to that. How use
invasive
genetics?
Is that? What even is that?
You can do it through a brain scan. Right now, we don't do it on people who are normal because we don't know how to use that information. But people who have memory loss, the amyloid brain scan can be very helpful to see if they have risk for Alzheimer's dementia in the future and start treatments before they have dementia.
Yeah. And in terms of the research domain, right, you can image amyloid in the brain, you can measure amyloid, and it turns out phosphorylated tau, which is even more powerful, in the CSF.
Right.
And then it turns out they leak into your blood and you can measure them in the blood. And there are measures of neurodegeneration in the blood. So what we're working on with neurologists and other researchers, including in this study, is how to develop markers that are like the cholesterol and troponin for the heart, for the brain. So we can measure brain health decades beforehand. And we already have these measures. What we need to do is validate them so we know how to use them.
And then ultimately, I mean, the costs associated with caregiving and all of that, they're pretty extreme when you're talking about dementia. I mean, it's not just an actual financial cost, but the emotional cost to the people around you too is significant. And I think that is when you talk about dementia, that's the fear that hits people first. It's not just the idea of, oh, I might not remember. It's what would happen to my family? How would they afford this? What would they go through? So I do think that as these studies are coming out there, that we should be putting more focus and more attention on this, because we are very naive about how to take care of ourselves and prevent illness.
Yeah. So our biggest push, both in the research and in the clinical arena, we've recruited another expert here, and we're working with other experts, is on caregiving, and both paid and unpaid. And too often it's just knowing how to get it, knowing where services are, and maybe Dr. Masurkar will expand. And then the other thing we've spent a lot of time on is on sensory losses. Vision we want to study, and we've done a lot with hearing. And hearing aids are getting better and better. And there's a national campaign to know your hearing number. And on any given cell phone, you can download an app and test yourself. And if you have a problem, go, yes.
That's so interesting. I had no idea.
Look up the Know Your Hearing Number campaign. And a friend, Frank Lynn, and his colleague, Nick Reed, are very much trying to get everybody as another number, blood pressure, cholesterol, but also hearing. And we've published last year that among the people who are at high risk for cognitive decline, in the first 3 years, you can reduce the decline by 1/2 in those people randomized to hearing aids. We also it was complicated because some people with hearing loss were sort of the worried well and didn't have cognitive decline in the first 3 years, in which case you couldn't improve it. But probably getting it early is good for later, and it's good for sort of addressing issues of social isolation and other issues like that. But hearing aids are making dramatic leaps. They do take patience. They're getting cheaper. There's more over the counter, but you have to get the fittings right. And when you don't like it, you have to work with audiologists. NYU has a whole program with also cochlear implants for those who need much more advanced care.
It's interesting how much more patient we are with doing things for our vision than we are for doing things for our hearing. If you can't see something, you totally freak out and you'll sit for hours with somebody to help you. We're a stubborn group. Okay, so I want to get into a few of really quick before we go. Hypertension, diabetes, high cholesterol, all of these things that we are testing for. We do know. I know that there's this pushback against medicine in some cases, especially when it's like, I don't want to take a statin. I don't want to take this. So explain to us, when you see that number and that number goes down, how much is that protecting you from something else that you're not recognizing, like dementia?
Well, I think that the way I look at it is, when we're talking about brain health, the brain is connected to all the organs in our body, and you can't treat someone's memory loss without optimizing the health of their heart, the health of their kidney, the health of their blood vessels, their lungs, etc. And so I really stress with my patients how important it is to optimize their vascular risk factors through both medicine and both lifestyle. Even in middle age, I think that this is a critical inroads to optimizing your brain health for the future. And it is sometimes a tough conversation to get people to control their diabetes better, to change their diet, but it really pays enormous dividends. And I also highlight that it's not just about vascular dementia. Vascular risk factors also play a role in Alzheimer's dementia as well. So they can also prevent multiple types of dementia as well by controlling these factors.
And so ultimately, is the goal of what you're doing a cure or preventative, or both?
I think it's both.
Always both. And there's a quote from the Lancet Commission: it's never too early or too late to address dementia risk. right? And I think the important thing is different things at different stages. And the wonderful thing is you start early, even education for children. Better education, better cognitive development gets you resilience and lower dementia risk. And that's working and helping us as a society as we've gotten more education. In midlife, the vascular risk factors are incredibly important. And then I think once you get past age 75, you're going to need to deal with some issues. And past 85, I think these, maybe, the sensory deficits and the teamwork in terms of care, people can do amazing things together.
Well, I mean, I'm very impressed. This has been completely enlightening because I think that probably once you've gone through something like cancer, you think about your health in a different way and you try to be more proactive. But I mean, even the hearing thing and the testing of your plaques and brain and all of that, that's something I don't think about on a regular basis. So it's nice when you see a study that you can have the doctors actually come on and talk about it and get into a little bit more depth. So I thank you so much, Dr. Coresh and Dr. Masurkar. Thank you so much for being here.
Thanks for having us.
Yeah.
Absolutely. And just a question, Dr. Coresh, is there some place where people can find you guys, that they can follow this and find out what else you're doing on this stuff?
I mean, Google is great, right? You just Google, my name's pretty unique, so you're going to find it pretty fast. We're mostly doing research, and the neurology department at NYU is #1 in the world. So they've got, I think, now 300 physicians. So I think the idea of, the NYU Langone search will do very well. And
okay, awesome.
Dr. Masurkar's name looks pretty unique too.
Yeah, I was going to say Dr. Masurkar's name is pretty unique also. Yep. Yes.
Might be the only one in the
Well, then I guess people will definitely be able to find you as well. Thank you so much. Thanks for joining.
The hearing number, the app that you can look up is Mimi.
Okay, perfect. What was that again? Spell it?
I think it's MIMI.
MIMI. Okay, we should be able to find that.
Yeah, and we have a colleague here who's doing tons of great research with that.
Wonderful. Yeah. Thank you both for joining me today. I appreciate it.
Pleasure. Thanks for doing it.
Absolutely. And thank you all for joining us on this podcast. For more episodes, go to the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts, and join us next time. Have a blessed day.